require just one treatment. 25% of patients will do a second treatment 2 or 3 months down the line. To treat an area, each flank, we charge $750. So to treat both flanks, it's $1,500. I break the abdomen up into 2 areas, lower abdomen and upper abdomen. Unless the person is small, then I consider it one area. So the upper abdomen is $1,500, the lower abdomen is $1,500. So the upper back is $750 and the lower back is $750. And those are our pricing.
Okay. Are any studies being done yet on the inner thighs or the banana roll areas or outer thighs?
Yes, and believe you me, they're working feverishly to come up with an adapter device to fit those areas. In some patients, the device that we use to treat the flanks can work on the inner thighs and outer thighs. But that's probably about only 25% of patients. So they're developing a special one just for that. I anticipate that should be out in about a year. Same with the one to treat the backs of the arms and under the chin, probably in about 18 months.
Now, what is the particular name of the machine that people should be looking for, Charles?
The machine right now that's the gold standard is called Coolsculpting. And that's Coolsculpting, Coolsculpting.
Now, I've heard of a couple of other names. Is this also called Zeltique?
It used to be called Coolsculpting by Zeltique.
Okay.
And the company now has made a decision where that was just too confusing with different names, and they're moving to one name and just calling it Coolsculpting.
It certainly is confusing. I mean, a lot of these names really don't mean much. There's some variation on Latin or Greek, and people really get confused with them. And that's why I'd like to also spell out, there's another machine out there right now called Zerona, which people get confused about. Well, what's the stuff about Zerona? Do you know much about it?
I do. The Zerona, when it works, it can work well, but it works much less of the time, and it's not a permanent reduction. With cryolipolysis, you actually kill the fat cells.
Yeah, and I understand with Zerona that it makes the fat cells permeable, but those fat cells then come back again.
That's right. That's a disadvantage there. It's not a permanent solution.
Absolutely.
It does not kill the fat cells. So, and that's why, in our practice, we've opted to go with Coolsculpting rather than Zerona. But we do get a lot of questions about it. And in some patients, it does work well, but it doesn't have the long-lasting effects or the widespread effects.
Yeah, I personally am trying another machine in my office for the next couple of months, something called UltraPulse 3, that hasn't been hasn't been brought out in the United States yet. This is a rather interesting machine that focuses sound waves. It's an ultrasound machine that, through a lens, focuses it so you can go to any depth in the fat compartment. So you can go down all the way to muscle and all the way up again. And there's some very good Canadian studies where there's an 80 to 95% response rate as well.
I've heard some really positive things about that. Really positive things.
Yeah, there's several doctors in Canada that have used it now. There's about 80 machines in Canada, so that's something that's down the horizon. Whether it'll work better than Coolsculpting, I have no idea. But the important thing is there's many options for patients now, and whereas one might work in one person, something else might work in another.
As you taught me, it's always nice to have many tools in your toolbox.
Absolutely, and we can use them like different paintbrushes so that we can use the right one for the right patient. If we can ever figure out which one we use at the right time, it'll really be a great thing.
Exactly.
Now, you and I, Charles, have also gone way back with this, and before the advent of Coolsculpting, there was something called LipoDissolve. Tell me a little bit about LipoDissolve and tell me about your experience with it.
And, LipoDissolve I still use on a regular basis, and it's still one of the main things that we use for sculpting and dissolving unwanted fat. And LipoDissolve comes from the injection of a chemical called phosphatidylcholine, also known as lecithin, which is an emulsifying agent. It has to be stabilized with another agent called deoxycholate, which is a bile salt. And it's still a little bit unclear, do they work together, does one work better than the other? But I use a solution that has both of them, and it tends to work very well. But it causes a lysis or a rupture of the fat cells and also a permanent diminution in fat. And with that, you can treat all areas because you inject the medication in the area and then you massage it afterwards, and you can treat any area to melt away unwanted fat. And my success rate, I would say patient satisfaction runs around 80%. So 4 to 5 patients get a really nice result.
Yeah. And again, it's mainly for the smaller areas of fat.
Smaller areas, yeah.
Yeah.
I'll treat lower abdomen, upper abdomen, love handles, kind of the outer thighs or saddlebags, under the chin, and sometimes, in special cases, behind the arms.
Yeah, and that's the thing about this. Now, there are some downsides of lipodissolve that I find are a little bit disconcerting, but as I say, a little bit. One is there is some swelling and edema that lasts a week. The other thing is it does burn a fair bit in some patients, and they find that disconcerting. Is that not right?
Yep, and I think there's some things that we've done to at least make that a little less concerning. And this is a trick that I learned from you. A lot of times I'll do ultrasound massage both before and after the treatment. I think you do it ahead of time, it makes the cells a little bit more susceptible to the treatment. Afterwards, you get it spread on a nice, smooth, even manner. You get a smooth, even response. One of the other side effects, sometimes you can get little granulomatous or inflammatory nodules where you do the injections. You can't see them, but you can feel like little pea-sized nodules that last a few months afterwards, and some patients have problems. But by massage...
And the other thing I found that works as an adjunct to this is something called endermology. Using endermology a couple of weeks after the procedure, I find it helps to make the fat and edema go away much quicker.
Yeah, so that's a great idea.
Yeah, and I'm not sure if you have that, Charles, but I've also heard of people using endermology without even the machine turned on, just using the rollers from it.
Just the rollers to massage it away. Sure,
yeah.
That makes a lot of sense. We also will have patients wear Spanx compression undergarments for a week or so afterwards, and that tends to help a lot.
Spanx are really useful for all these things because any of that edema, any of that swelling goes away. It's like wearing a compression when you've sprained your ankle, and it really helps to put a little bit of pressure on that area to make it nicer.
Yeah. Well, I will say that I just did a search the other day. We've actually treated over 1,000 patients, I think about 1,100 patients with lipodissolve, and unique patients, and we've done over 13,000 treatments, and so the side effect profile is really good. We haven't had any major or significant problems at all.
Any chance you're going to publish all that sometime, Charles?
I'm actively working on it right now, and hopefully by the end of the year we'll have a submission and it'll be published.
I had put together a paper with a couple of other dermatologists, a couple of other doctors a couple of years ago, and that was rejected by one of the publications, and we never got around to resubmitting it to another one. So if you get it out there, Charles, you'll be the first one that will have a big, big study, which is huge.
Great. Yeah, like all of us, we've been doing this for several years, and yes, there's some certain concerns, but no major problems with it. And there's no procedure without risk. I mean,
there is no procedure without risk, and I think the average consumer has to realize that any time that something is done, there's got to be some risk, otherwise it wouldn't be a useful procedure.
Yes.
But at the same time, the procedure has to be done in such a way that those risks are minimized. And they have to be done in such a way that the risks to the patient are small and the results are huge.
Yes, and these procedures so far, at least in development, be it the lipodissolve or the Coolsculpting or even the ultrasound waves you talked about, it's so nice that we're developing new techniques that are getting nice results where the side effect profiles, even though they exist, are minimal.
Now, I'm going to ask you one that bothers a lot of women, and that's something called dreaded cellulite. Mm-hmm. What the heck is cellulite, Charles?
The cellulite is a genetically determined kind of dimpling of the skin, and there's really kind of two forms. There's the form that you see with pressure, so if you sit in a chair and you're wearing shorts or a short skirt that you can see dimpling, and it's from pressure. But there's also another type of cellulite that you see at rest, if you're just standing and you can see dimpling in the legs. But it really has to do with a genetic condition where you have fibrous bands that are tugging down on the fat cells.
Yeah, the way I like to think of it is 2 pounds of fat in a 1 pound bag.
Yes.
So you get a little bit of overstuffing going on, and it's amazing that you only see this in women. Men, I've never seen a man with cellulite yet.
In fact, I saw a study where they looked at men and women, and about 94% of all women have cellulite, and probably less than 5% of men.
And you can really see this on a lot of women. If you get them to suck their cheeks together on their buttocks, a lot of dimpling occurs there.
Right, and it's the thing that's interesting, it really doesn't have anything to do with being overweight. It's all genetic. In fact, one of the first patients I treated was an Olympic volleyball player. And she was 27, probably working out 4 or 5 hours a day, but she said, no, this runs in my family. My sisters have it, my aunts have it, my mother has it. So it's a genetic thing.
And boy, does it bother women, doesn't it, Charles?
Yeah. Yes, it does. It's a tremendous concern.
So what do you do to treat it? What is a good way to treat cellulite?
Well, there are really not a lot of good ways. However, the endermology that you talked about, that was the pioneer in the field of treating cellulite. And it can work well, but you have to do persistent or consistent treatments. And for a lot of patients, it's worth it. The other thing that I've done is lipodissolve, and it tends to work well to treat cellulite. Now, the success rate is not as good as sculpting. Sculpting is probably 70 to 80% success. I am happy if I can get a 40 to 45% success rate in reducing cellulite.
Now, the technique's quite different for cellulite treatment than it is to treat an area that has a localized fat deposit, is it not?
That's right. And what I'm really trying to do is cause an inflammatory response to rupture some of the fibrous cords that are tugging on that fat, that 2 pounds of fat in the 1 pound bag. Yeah. And my goal is I don't want perfection to be the enemy of very good. I want patients to look in the mirror afterward and say, maybe it's not all the way gone, but it looks so much better and smoother than it did. I'm happy I've done the treatment.
That's absolutely correct, and I think that's another thing. Do you think that this new Coolsculpting might do something for that?
It's not proving to do that right now, but we're keeping our eyes open. And so it's not billed to treat cellulite. It's just billed for reduction and smoothing and sculpting. And that's probably the advantage of lipodissolve over Coolsculpting. But it's so new, the jury's still out.
And many of these techniques are still in evolution, and that's I think the key with it. I think we'll find out more as time goes on, and we'll get better at treating these things. And at the same time, we're gonna get smarter. We're gonna know how to use these better. When we started doing lipodissolve way back in, where was it, about 2003, 2004, someplace in there, people thought we were crazy, and they really came up with saying, this is not science, this is nothing else. And yet you and I persisted and used it for a long time, and we got some real good results.
Yes,
and I think that's true of this liposculpting with Coolsculpting as well. I think we're still in the infancy of that technique. I still think we've got a lot more to learn.
And, I kind of draw the analogy right now, and there are 3D telephones out. Have you seen any of those yet?
Yeah, and somebody sent me an email about a 3D printer the other day, which was amazing.
It's amazing. So my barber he pulled it out and he showed it to me, and I'm looking at it, and it has depth. It looks like you're looking into a three-dimensional box, but it's just a flat phone. And he laughed, and he said, you know what, even though this is new and it looks good now, this is the worst it'll ever look. It'll only get better from here. And the same thing with a lot of these cosmetic treatments.
Well, you've probably got a wonderful HD TV like I do. Mm-hmm. Boy, is that different than seeing other things. I mean, to watch a sports show on an HD television is so much different than watching one before. It's like the difference of night and day.
Night and day. And so a lot of these techniques are the same thing. Even though it's great now, it will only get better. This is the worst it'll be.
Yeah. But again, as every doctor must make a decision, they got to make a decision at the right time. And they have to jump in at the right time. And that's part of the art of doing cosmetic surgery.
Right. And part of it is going to somebody who has experience, who's respected and trusted. And the secret that you and I have is we have other colleagues with years of experience. So when we make a decision to adopt a technology, we might have consulted with 4 or 5 or 10 friends with a cumulative 50 or 100 years of experience.
Yeah, it's so much easier for us to step on the shoulders of giants rather than having to do it all ourselves. We do it
all the time. And the nice thing is our patients reap the benefits of that.
Now, Charles, one thing people are going to be asking me is how can they get in touch with you? How can they find out a little bit more? How can they make an appointment with you? Now, give me your address, your phone number. Give me something so that people can contact you if they like.
The thing is, once again, it's Crutchfield Dermatology, like a crutch in a field with a C. And so our website is crutchfielddermatology.com, CRUTCHFIELD. We also are on Twitter and Facebook, and our phone number is 651-209-3600. But the best way is to take a look at our website, crutchfielddermatology.com.
Repeat your number one more time for anybody that wants to call it, Charles. 651-209-3600. Charles, I really have to thank you for spending the time with us today. I really have to thank you for all the information that you have here and that you've shared. I think people will be asking you questions, and I'm sure even other doctors will call you about your information and knowledge. It's one of the great things that we can offer is knowledge, and we can serve people better that way.